Thank you. Good afternoon to you and everyone that is joining us this afternoon. I do want to say again, go to Reem and CKON for providing time for me to provide the community and yourself with an update. I want to mention that we are streaming live on our MCA Facebook page, and we're also recording this to share later on for other in other means. For the audience this afternoon, questions will only be answered during our live talk show at CKON by calling into CKON at 575-2101 or 358-3427. We will not answer any questions from our Facebook page during our live show. So now it's been over 6 months since we've declared a state of emergency for our community of Akwesasne. It's completely unbelievable how much time has passed and where we are today. I want to acknowledge, as always, that dealing with this pandemic and taking all the necessary precautions continues to be challenging for all of us. And on behalf of myself and our council and the Mohawk Council of Akwesasne, I want to thank everyone for continuing to practice all the recommended precautions in our fight against the spread of COVID-19. It's really important that people not adopt a false sense of security about this pandemic at this time. This pandemic is not over and everyone is still at risk. We have to continue to be smart and proactive. We need to continue to please wear our masks and maintain 2-meter distance from others in public. With the increased number of positive cases around us, we feel that we are now entering into a second wave of COVID-19. For today's discussion, I want to provide updates on the recent changes to the Akwesasne Emergency Curfew Law, the COVID-19 Business Relief Fund, potential Halloween and holiday dinner festivities, and preparing ourselves for a second wave. The last time I provided an update to the community on CKON's Dadawatala was over a month ago, on August 11th. During the past month, there have been a few amendments made to our Akwesasne Emergency Curfew Law. On August 24th, our council voted to increase the travel radius from 80 kilometers, 50 miles, to 160 kilometers, 100 miles. But the city of Montreal continues to be excluded unless you're traveling to that city for essential purposes, such as medical appointments. This exclusion is due to the high number of positive COVID-19 cases in the Montreal area. On September 14th, just last Monday, our council voted to lift the curfew altogether. At the start of the pandemic, the curfew was set for between the hours of 10 p.m. and 6 a.m. And then later in June, the curfew had been reduced to between 11 p.m. and 5 a.m. And now we have lifted it altogether. In addition, on September 19th, the limitations on the allowable number of people for social gatherings was reduced to 10 for indoor gatherings, which was previously set at 25, and 25 for outdoor gatherings, which was previously set at 50. These reductions were put in place by the province of Ontario. The Eastern Ontario Health Unit is following these limits, and the Mohawk Council of Akwesasne follows the Eastern Ontario Health Unit guidelines. These limits apply to unmonitored and private social gatherings, such as functions, parties, dinners, barbecues, and wedding receptions held in private residences, backyards, parks, or other recreational areas. The new limitations do not apply to events or gatherings held in locations that are monitored by staff, such as restaurants, cinemas, convention centers, banquet halls, gyms, places of worship, recreational sporting events, or performing arts. Again, those are monitored situations, centers that the social distancing is enforced and the limits are enforced. I want the community to know that although despite these recent changes, we need our community to continue to be diligent about continuing our practice of all the recommended precautions in our fight against the spread of the COVID-19. This includes the washing of your hands frequently for 2 minutes at a time, keeping a distance of 2 meters between you and others, especially in public, and avoid touching your eyes, nose, and mouth. The Mohawk Council of Akwesasne Economic Development Program is offering a COVID-19 Indigenous Community Business Relief Fund. $100,000 has been provided by Indigenous Services Canada for distribution to our local entrepreneurs. This fund is specifically identified to address the COVID-19 issues for businesses that are registered with the MCA Economic Development Program. Examples include the purchase of PPE, the purchase of public safety divider shields are just some examples of what this fund has been designed for. Businesses are encouraged to fill out an application. Even if you have not had any expenditures, please fill out an application. If your business had to close, your application will be reviewed to determine in any way that your business can be supported through this relief fund. Eligible businesses include small businesses, micro businesses, artists, caterers, beaters, designers, distributors, and physical fitness trainers are an example of some of the businesses that will qualify for this fund. We also want to encourage our youth, our young entrepreneurs who have been impacted by COVID-19 to submit an application as well. And those are the youth ages between 13 and 17 will be eligible to access this fund. We want to ensure that there's a fair process and gives every business an opportunity to access these funds as they are unable to access, if they're unable to access other support to support their business. Applications can be emailed to you, or it can be picked up by making arrangements, and we will ensure that all public safety protocols are followed in the pickup. You can request applications by calling our Economic Development Office at 613-575-2250, extension 1802, or by emailing ecdev@akwesasne.ca. We also have a Facebook page. The MCA Facebook page is a means to contact them. Applications must be completed and submitted to the Economic Development Office by the deadline of October 9th, 2020 at noon. You must not have received any other COVID support funding from any other source. If an individual owns more than one business, only one business will qualify under this fund. All applications submitted will be reviewed the week of October 12th, and if there are any questions with the applications, you will be contacted. We expect the distribution of funds that are for applications that have been approved will happen on the week of October 26th. 1 month from now is Halloween, and Christmas follows that very soon after. Council wants to be proactive in planning properly for these holidays. At this point, we have established a council committee that has looked at the two separate events, one for Halloween and one for the holiday dinners. These chiefs committees are going to be working to develop and discuss options for consideration by our full council. The intent is to have a plan in place prior to each of these holidays so that the community members may still be able to participate in these festivities, even if it's modified from our usual celebrations, while also making sure that preventative and precautionary steps are being taken to ensure the safety of all of our members in our community, especially our most vulnerable. So we want to ensure that you're aware that we are working on a plan for Halloween and Christmas dinners that we would normally have. The number of positive cases in our surrounding areas are continuing to increase. It's starting to feel like it was right before summer. This potentially could be setting the wave for setting the stage for a second wave, as the colder weather is coming and the virus likes the cold temperatures. And we're also heading into the regular flu season. And the cold temperatures allow for these viruses to spread fast. The positive numbers in the local areas are the Franklin County is reporting 65, St. Lawrence County is 318, the Eastern Ontario Health Unit currently has 41, which includes 3 active in the city of Cornwall. What we need is to remember is what we have learned from our first wave. Back in March, things were scary because most of our questions, the answers to our questions was we don't know yet. But now we know. We know how important it is to have ample supplies of our personal protective equipment on hand. We know that the COVID-19 can spread from asymptomatic people. We know who is most vulnerable. We also need to be able to improve our responses because of what we have learned. The best thing that everyone can do to help the hospitals out for the second wave is to be diligently practice all of our safety precautions. Don't get sick and don't get others sick. Everyone who is more vulnerable needs to take extra precautions. We need to protect our community and especially our most vulnerable community members. The second wave may be inevitable, but whether it's a big wave or a small wave is completely up to us. We can ensure that it's a small wave by continuing to practice all of the safety precautions at this time. To reduce our chances, again, of being infected or spreading the COVID-19 virus, we need to regularly wash our hands with an alcohol-based hand rub or wash them with warm soap and water. Maintain at least 2 meters or 6 feet distance between ourselves and others. Avoid going to crowded places. Avoid touching your eyes, nose, and mouth. And make sure you and the people around you follow good respiratory hygiene. Wear a mask or other face coverings when indoor public places. Stay home and self-isolate, even with minor symptoms such as a cold, headache, or mild fever until you recover. Have someone bring you supplies. If you have questions about the COVID-19 or you have symptoms, we ask that you please call the MCA Community Health Program for pre-screening by phone. And if needed, they will schedule a COVID-19 test for you. Please keep up to date on the latest information from trusted sources. I can't reiterate as much that we need to continue to prepare for a possible second wave, and everything that we were concerned about, i.e. ensuring that our homes are set with enough food so that we don't have to head out often, and ensuring that we have the necessary necessities. We should start all thinking about that. Reen, that is everything I want to cover this morning and to update you and the community on. I am open to take questions from you or the community.
All right, thank you very much. Again, we're talking with MCA Grand Chief Abram Benedict, discussing some bullet points that he has brought forward, and he's through with his presentation. So again, if you have any questions for the Grand Chief, our phone lines are open, 518-358-3427, 613-575-2101. To let people know, we will close the show right at 1 o'clock. So if we don't get to one of your questions, I'll make sure that the Grand Chief at least gets a copy of it so that he'll know what the community is thinking and asking. So my first question is going to be from a listener. Was the recent joint press release by MCA and the tribe announcing positive case numbers for both sides, or was it just for one side? I do have a few that have come in so far, Grand Chief, that have to do with the positive test results, if there are any, in the 3 districts, and why those aren't being brought forward, specifying when they're in the 3 districts. So that'll be our first question. Was the recent joint press release by MCA and the tribe announcing positive case numbers for both sides, or was it just for the southern portion?
As far as I'm aware, the recent release was on the southern portion. We generally have joint releases with the tribe. Our numbers are covered under the Eastern Ontario Health Unit, and they provide those updates. But as far as I'm aware, those releases, which were I think maybe a week and a bit ago, were on the southern side of Akwesasne.
All right, so another question. A press release by MCA stated they are not releasing any positive COVID-19 cases due to privacy issues, and that Akwesasne's numbers are listed on the Eastern Ontario Health Unit website. But if you look, it only lists Cornwall. Why won't Akwesasne release any positive numbers when Kahnawake and 6 Nations are releasing their numbers?
Yeah, so we've received this question a couple of times now. I know that Council has discussed this back and forth. Currently, because we are under the Eastern Ontario Health Unit, the numbers are lumped in with Cornwall's numbers, because we are, that's the closest region to us as part of the Eastern Ontario Health Unit. This will continue to be something that we'll continue to examine. I know that people get fixated on the numbers and want to know exactly, what area or what region they are. We must continue to, be diligent on our actions and ensure that, we're being safe. And we really need to, not treat everybody as though they're positive, but that everybody potentially could have the virus. But going forward, we will continue to examine this. I will take this back to Council. I know this comes up often. People want the numbers broken out. We'll have a conversation with our Council and our health folks to see if this is something that can be done. But currently right now, yes, they are lumped in with the Eastern Ontario Health Unit as of right now.
So with the 3 in Cornwall, do any of those concern Akwesasne?
To the best of my knowledge, they do not.
All right, so another listener's comment, MCA puts out a lot of recommendations and regulations out there for safety, but which I think is great. But if the community is given false security by not publicly reporting when there is a case on the northern portion, it is contradicting the safety measures, says one listener.
Yeah, I know that, again, back to the other question, people want to know if there are positive cases specifically within the northern portion of our community. This is something we'll continue to examine. We need to continue to ensure that, our actions are conducive to keeping ourselves and our community safe. We know the numbers are going up around us. I would say that, based on that, the Ottawa numbers are on their way up, unfortunately, within the two counties. They are slowly going up. And Cornwall, in fact, had a recent increase over the weekend of about 13 cases, or the Eastern Ontario Health Unit region, of 13 cases. So, they are on our way up. We're not immune, and we just need to continue to do our part and practice, all the safety measures and act as though, the virus is right at the door, and be safe.
So is council responsible for that decision, or is it our Department of Health?
So the decision, if we were to break them out, would have to be done in collaboration with the Eastern Ontario Health Unit. You may recall that earlier in March, when they were reporting the numbers, it was only aggregate numbers, meaning they only reported for entire region. They have broken it down recently. We would have to talk with our health department, as well as the Eastern Ontario Health Unit, and council would have to discuss that as well to determine whether or not those numbers should be broken out, and how they'll be published to the community.
So if someone wanted to follow up with that, since we have received a lot of comments on that, would you recommend that they contact Dr. Paul at the Eastern Ontario Health Unit? Can they go that route?
I'm not sure that they would provide them specifically for Akwesasne. What I'll tell you, Irene, is that it's been a month since we were on. I'll commit that I'll come back to you within a month and another update with the community, and we'll have a definite on that answer.
Okay, so another listener, CCVS and Salmon River, have said they will inform students and families if there is an outbreak. Will the Amby schools be doing the same?
Yes, so our students are went back this Monday to school in a hybrid model. Some students are at home. There is not a specific number that will say that the schools will be shut down. This will be on not a case by case, but a scenario by scenario, based on a transmission, based on where the case was received. If there was a transmission within a school, if it was transmission outside the school, if it was a family member of a student. But if there is cases, the persons who may have been exposed will be notified via the contact tracing route, but also the schools will be notifying and taking appropriate measures to ensure that that going forward, that the risk is low, and if it is not low, then they'll be taking measures to modify the delivery of the education system at that time.
So Amby will be letting the community know?
Yes, they will let the parents know if there is a risk to the students.
Okay. Another question from a listener. Grand Chief, I've seen a tractor trailer carrying 3 cars parked at the Peachtree Mall. Are they doing this to dodge tax? This issue has been going on for a while now. What can MCA, the council chiefs, and yourself do to address this?
The issue of taxation on vehicles being delivered to the Peachtree Mall is ongoing. We have sent letters to all of the local dealers, well, all of the car dealers within the Cornwall, Ottawa, Montreal region, letting them know that if there are deliveries to be had at the Peachtree Mall, that they need to inform us. And the concern is about non-Akwesasne receiving vehicles there. I'm not aware of a tractor trailer with 3 vehicles, but if we see these situations, we are following up, investigating them. It's ultimately up to the car dealer or the person selling the vehicle to ensure that proper documentation is provided for tax exemption, because if they're selling a vehicle with no tax to somebody, likely the tax man is going to come back on that dealership and they will be out that money. So there's documentation that is needed, but in these specific situations, if there are concern with tractor trailers with vehicles on it, please contact our office and we will follow up immediately on them. But all dealerships have been informed of the protocol.
All right, again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict and answering questions from community members during today's program. And again, our phone lines are open at 518-358-3427, 613-575-2101. Grand Chief, someone would like you to repeat the Halloween information that you presented, please.
We have not made a specific recommendation on what's going to happen with Halloween. We have a committee that's formed that's examining what some options may be. They are working with other community stakeholders, groups that generally put on festivities for Halloween. We're working in consultation with the emergency operations centers of the tribe and the Mohawk Council. We have not rolled out what that will look like yet, but I can tell you that we are actively working on that now. We want to be able to recommend to the community, this is what the approach should be, to be able to keep themselves, the people that are giving out candy, and the children safe, but also ensuring that, there is some sort of safe festivity for the holiday season, the Halloween season. Stay tuned, it will be coming.
Okay. So another question from a listener, when will the meeting be for Halloween? And can other community members join with regards to this meeting?
I don't know that a meeting is happening with the community. There is a committee of chiefs that are working on this initiative. They are reaching out to various organizations, so we can, if you would call our office and ask which chiefs are on that committee, we can relay that to you, and you can speak to them directly. But they are working with some of the some of the groups in the community that generally put on something for Halloween.
All right, so another question. Now that the curfew has been lifted, what happens to the law that was passed by council?
So the law, the emergency response law that we enacted still continues to have stipulations around the travel radius. So the law is still in place because the travel restrictions is still there, which is 160 kilometers, 100 miles from the community, meaning that if you come into the community from outside of that location, you're required to quarantine in your home for 14 days. That law still continues to apply. So while it may have said the curfew law, there are other elements of the law that are still in place to be able to protect the community.
All right, another question. Is there anything being done for food sustainability? The caller knows they did garden boxes. Will they do something further for traditional foods? The canned foods aren't healthy, they said.
So we have been examining what some food security options may be. We are in the process of reviewing what our options may be. I think that, with the cases rising, this may be implemented sooner than later. Because we are running out of time per se to plan for more of a longer term, we may be in a position where we're going to have to just stockpile some non-perishable items. Could be canned goods that maybe are not the most healthiest, but we're actively examining what some options may be. Unfortunately, I think we're running out of time to be able to establish some systems that have the systems that have more longevity in them than just stockpiling, but we're actively looking at this right now as we move into the fall season. In the spring, we would likely, or perhaps even over the winter, we may look at implementing a longer term solution, but unfortunately, I think we're running out of time on being able to set something different up.
All right, another question, Grand Chief. I would like to know how many citations were given out during the last 6 months since COVID. Specifically, how many citations were given from the curfew law, the burn ban, etc.?
I don't have the numbers offhand. I do know that citations have been issued. Fines were levied on persons for not abiding by the curfew, as well as the garbage burning ban that was in effect. But I don't have them. But what I can do is I can get them, and I can make sure that they're published on our Facebook page prior to our next update, which would likely be in about a month.
All right, and listener wants to know, can you please clarify what parents will be notified? If someone at my child's school is infected, I would like to know, would I be notified?
Immediately, the classroom would be notified. If there isn't a set course of action on these, because if the transmission is from, say, students student's parent at home, but the student hasn't picked it up, then there is not a transmission into the school. People generally won't be notified if a child or staff member comes into the school with the virus and is transmitted outside from one student to another within that classroom. That entire classroom will be notified, and any other persons. We will ensure that the adequate information is given to the parents and to the community at large going forward.
Again, we are talking with Grand Chief of the Mohawk Council of Akwesasne, Abram Benedict. I do apologize for the view on our side. I'm having trouble with our holder, so that's why you can only see my forehead, I guess. So I apologize for that. They would like to know, can they hold yard and lawn sales?
It's getting a little cold out now. I think we have we have maybe a few more days or weeks of warm weather. And earlier on, when the pandemic had started in March, we really wanted people not to have lawn sales. I mean, this was kind of when we were hunkering in place at home. This question has been asked. Lots of the Eastern Ontario Health Unit has asked of us a couple of times. People, if you're going to have a lawn sale, it should be outside. It'd be a lot easier, and people need to wear masks and social distance when they're looking through the wares there. I mean, there should, as a responsible community member selling their wares, please ensure that people are aware of the necessary precautions that need to be taken to be able to peruse what you're selling. But that's really the guidance that we have been giving on that.
How are things going with community members with regards to their appointments at Leo or say OBS or housing or to see chief and council? How have those things been going for community members? Is everybody used to the way things are being done now, or are we still struggling with that, if we struggle at all with that?
So in our last update, we talked about what, the MCA resumption plan. We've talked about this quite often. All services are being provided from the MCA to the community at this point. Earlier in the pandemic, we had stopped providing some services that, were discretional. The clinics, are all operating. Lots of them are virtual. There will be calls, but they still are open to in-person visits with the health professional. Most services, you need to call ahead of time to set up a time so that we don't have an abundance of people from the community coming into the facilities. Now, every facility is open to the community, but we ask that you please call ahead and make an appointment. There are some services that are going to be available online. A lot of applications, policies are going online. Other services are doing, outreach, going to you to bring, applications, to intakes, things like that. There's various different models of delivery happening. So all of the services that we had provided, saving the fuel except, i.e. the arena, are all operating right now. We just need to call ahead and ensure that, to understand what the protocols are in place to access that service. When
will Mohawk Council of Akwesasne be announcing the heating assistance that is normally put out to the residents of the 3 districts? When is that coming?
So this is not announced yet. It was approved on Monday, which I do provide to you, Reen, and the community, my updates on Thursday afternoons, and we provide them on Fridays. But this past Monday, our council approved an increase of the heating assistance program. We approved an increase to the elders, an increase to the heads of household. We have not set a date yet, but this will be rolling out likely in the next coming weeks, probably a month or so. It still will be through the community support program, but we know that with this heating season coming, with more people being at home because the children either are taking school virtually. Some people may not be working or maybe working from home, that the heating costs will be going higher because we're in our homes more. And so in response to that, council has increased the allotment and that will be rolled out likely in the next 3 to 4 weeks. We'll be announcing intake dates, but this is kind of hot off the press news. We've increased it for this year.
Excellent. Again, we're talking with Grand Chief Abram Benedict, Mohawk Council of Akwesasne. And if you have any questions for the Grand Chief, you can phone them here to the radio station, 518-358-3427, 613-575-2101. And quickly, while we were talking about fuel, what is the age for the seniors, for the elders assistant? What's the cutoff age?
Oh, goodness. Would be no more than 65 for the seniors. It could be a little bit lower. I don't know offhand. So when we do roll out that information, in the coming weeks, we'll identify what the elders bracket is and what the parameters are for head of household.
And another listener, do you have a plan to encourage people to boost immunity through eating healthy vitamins and traditional medicines, etc.?
Just back quickly, I have my staff providing me a message 60. So the age for the elders is 60 on the home heating fuel, home heating assistance program. So the programs that we have available, well, we don't have a specific program. We did have the green food bag program, which I think was discontinued because of the COVID. Currently, right now, there isn't any program that I'm aware of that has healthy, active promotion. But we can follow up and find out what our health department is providing for this. But going forward into potentially a second wave, like I said earlier, we are planning for a food, security initiative. Likely will not be greenhouses this year, but it is something that we are seriously considering going forward as we look to expand our land base to be able to ensure that we have, access to clean, healthy food for our community that is local and not, brought in.
All right, now another question. Looking at Yakisota and Jiungunusade, how are the visiting restrictions going there? Have they been lifted at all? Has it been eased at all at either of those facilities?
The last update that I received was that visiting has resumed. You recall earlier on that visiting had been restricted, and then it was stopped, and then it was restarted. The visitings are still happening in person with all of the safety precautions in place for the community to be able to visit their loved ones within the facility. I must say, though, that if the wave, if we do experience a second wave, we need to recognize that this could change again. I mean, the precautions that we put in place are to ensure that, we don't get the virus into the home and we're not putting our at-risk goods at any more risk than they already are. So I just need to put that disclaimer out there, but the visitings are still happening as they have been since the last time we reported.
Now, is there anything that can be done about the loud four-wheelers that race around all night long noise ordinance?
Over the last little while, we've received, regular questions on our update hearing about garbage burning, about four-wheelers, about noise, people out, driving about outside of the curfew times. I encourage folks to please call the Akwesasne Police Service, file a complaint with them about, four-wheelers. I do know that people get upset about this, but when I check in with the police services on these issues, sometimes they tell us that we haven't received any complaints about this. So I need people to ensure that the police services are aware of that and that they can investigate and find out, or follow up on the complaint. But this is something we'll bring again to the attention to the police services and let them know that, the four-wheelers at night is an issue, but folks need to do their part as well.
Now, for the upcoming MCA general meeting, do you have a tentative agenda for that? And how do people participate? Is that going to be done through Zoom again?
Yes, and unfortunately, for the next few months, we'll continue to have them virtually. We'll be using the Zoom platform. The general meeting is happening this Thursday, the 24th at 6 p.m. The agenda for this month, which is happening this week, general meeting is the 2020 MCA budget presentation. So we will present the budget for the MCA, give a breakdown of what what each program's budget is and identify what the expenses are for the year going forward. That information is available online. If persons want, community members want the information or the Zoom link, please email us at meetings@akwesasne.ca, and we will provide you with the link for the meeting as well as the material for the meeting. Every month we ask that people please ask for the link. We will send it over. If persons don't have the Zoom network, you are able to phone in as well into the Zoom network and listen in and ask questions. And any person or community member who wants to participate or listen in on the Zoom general meeting, you don't have to have your video on. I know some people are camera shy, which is fine. You can just not have your camera on and listen in and ask questions when the time comes forward. So email meetings@akwesasne.ca. We'll send you the link. If not, call the Mohawk Government Office and we'll provide you the phone number to phone into for this Thursday's general meeting, which is happening at 6 p.m.
Okay, we have a couple of questions with regards to Dundee. So the first one, can you provide any updates on the Dundee land claim? When are community members able to move there or purchase land?
So currently, the agreement has been settled. The proceeds have been received. We are, through our Aboriginal Rights and Research Department, going to be rolling out a comprehensive engagement process for the use of the benefits, that we will ensure that the community is well engaged on how the benefits will be, the settlement money will be used going forward. There is a process that is identified in the agreement for the acquisition of lands and turn them back into reserve. Through this process, we have to buy from willing buyer, willing seller, and then put them into the additions to reserve process to turn them back into reserve. So over the next little while, we'll ensure that this information is shared with the community as we begin the engagement process, and also we can share, what the approach will be for the additions to reserve lands.
Is there any way that we can use the settlement monies or even the Akwesasne Community Settlement Trust to utilize for COVID relief for residents of the 3 districts, for members of the Mohawk Council of Akwesasne? Is that something that's been looked at? Is that possible?
It has not been looked at specifically using those funds for any sort of relief. We have received, and we have provided this at the last general meeting and on our last update, monies from the federal government in relation to COVID to be able to help fight the pandemic or prepare ourselves for a second wave. We have continuously been asked whether or not we're providing direct benefits to the community. As I announced earlier, the fuel assistance is one of the ways that we're going to be helping people going forward. We do know there's more people at home. We're not going, at this point, we're not providing any direct stipends or checks to individuals at home. It's just not feasible. We do know through the period of the first wave, the MCA did not lay off any individuals. Thus far, we have not laid off very many, if any at all. But if, when persons are experiencing, financial hardship, they should reach out to, our programs. We've just announced last week, which I've reported earlier this afternoon, is the Business Relief Fund. So that took a little while, but there are some monies now available for businesses in the community, including artisans and beaters who are businesses in the community, to help them as well. If we go deep into a second wave and, there is some real financial hardships on the community, we will examine it then. But I can tell you that, part of our preparation for a potential second wave is the food security aspect, and we are actively examining that to ensure that we have that safeguard for our community.
Again, we're talking with MCA Grand Chief Abram Benedict, and we're going to be wrapping up at 1 o'clock, if not before. So if anyone has any last minute questions, get those into us. Other than that, we'll start to wind down. So looking at the different aspects of the Eastern Ontario Health Unit, I know that you guys issued the release yesterday with regards to bringing down the numbers for inside gatherings and outside gatherings as well. Now, is that something that's going to happen going forward? We're going to follow everything that Eastern Ontario Health Unit puts out, Grand Chief?
Likely, yes. They provide, recommendations to us. Council determines to adopt them or not. I mean, as we go into the fall, into the regular flu season, we'll be looking to those regional and national experts in the health sector to support, our decision making. And the Eastern Ontario Health Unit is the body that we look to right now to be able to provide that advice, including in collaboration with the Centers Mohawk Tribe and their EOC and their federal counterparts that provide advice to them as well. So those are all the bodies and authorities that we look to help guide us as we move forward as a community.
How are things going with the internet scene with regards to some of our children and families that are opting for the remote only learning? How are they doing with signals for Wi-Fi and actual internet in their homes? Has there been any update provided to you on that?
This has been a constant struggle for us as a community. There are some parts of the community that have good access to internet. There are some parts of the community that don't. We have been in conversations with Bell Bell Canada to ensure that we're getting some sort of speed here, and I can say predominantly it's small parts of Cornwall Island and then parts of Sny, mainly Sny, that don't have some either access at all or quality speed. We have received a grant to develop our own system here. They are working on that process right now to help roll that out. Unfortunately, these are construction builds, meaning that we have to put infrastructure on the ground and run those down the poles. That work is ongoing. We're looking at other ways to boost the systems that are existence or new systems, i.e. wireless perhaps from MCA infrastructure. There's examinations going on about that as well. We're having conversations with the Centers Mohawk Tribe and their enterprise over there to look at ways that we can continue to ensure the community has access to high-speed Wi-Fi. Just know that we are working on this, and this is not an easy fix because it is one, it's expensive, and two, it's not. We have to run infrastructure to be able to support this sort of initiative, and that takes a lot of planning and does not happen overnight. But we are actively pressuring our partners and internally to roll that out as soon as possible.
All right, we're going to close the phone lines now as we're going to wrap up with the Grand Chief in just a few moments. Like I said, close to 1 o'clock or before. So another question, what is the Seaway settlement plan, this council or next council, that will take care of that referendum?
Prior to the COVID being struck, we should have been we should have had a vote by now, if not going into it very quickly. Right now, we're in the planning process to roll that out potentially. A determination has not been made at this point on that. The COVID, the pandemic has really slowed things down and put the brakes on other initiatives, including the Seaway referendum that we wanted to roll out to the community, recognizing that if we do, it will be virtual. We will provide the information to the community virtually, and there potentially be online voting with possible in-person voting. But it's really the actions that we take as an organization, as a community, and as a government, we need to make sure is conducive to protecting our people in any other fashions that we used to do. It may not be the same as how we're going to have to do it going forward. We just can't risk having large gatherings. So stay tuned. We will update the community on that, and we'll provide ample notification of what the plan will be.
All right. So I'll back to you, Grand Chief, for closing remarks for this update for the community on Didawatala.
Absolutely. So thank you, Reen. We've covered lots of ground today. I do want to say that, I will come back in about a month or so. We were doing it every 2 weeks. If the numbers and we dip back into, a second wave very quickly, I will come back and update the community sooner than that, but we'll target 1 month from now. So it has been 6 months since the pandemic has started, and this has been extremely trying for everyone. I know that, and it's not over, unfortunately. But we need to we need to continue to hunker down and do our part. I can't repeat enough that we must continue to embrace all of the safety measures, all of the precautions that are the recommended precautions, including wearing a mask and maintaining the 2 meter, 6 feet distance from others when in public, and avoiding large social gatherings. I know it continues to be challenging. It's not easy for myself or other members of the community. We just need to continue to take this one day at a time and support each other along the way. Reen, thank you for the opportunity again. Yamagoa to you and the community for listening in and providing the time this afternoon to update all of you. I want to say Yamagoa to all of our employees who are working hard to keep our community safe, and to our listeners in our community for doing your part to keep our community safe during these very extraordinary times that we are in our community and in the world in which we live in. So Yamagoa, Reen, to you.